The nursing home called and they said, your dad has pneumonia. And you accepted that. Pneumonia is something that happens to older people. But then it happened again. And then it happened again. And you thought to yourself, look, healthy lungs don't fill up with infection for no reason. Something must be going wrong. And then he died. The nursing home never prepared you for that. They never had a good explanation for why he kept getting pneumonia. And then you got the death certificate, and it raised more questions than it answered. My name is David Terry. I've spent 25 years handling nursing home abuse and neglect cases, and I've seen this exact pattern more times than I can count. In this video, I'm going to tell you the one word that the facility left out. I'm going to show you why this happens, and I'm going to give you the one record that tells you whether what happened to your loved one was bad luck or neglect. There's a kind of pneumonia that has almost nothing to do with just catching a little bug. It's called aspiration pneumonia. And that one word explains a lot about the care provided by this nursing home. Aspiration means that food or liquid or even saliva goes down the wrong way into the lungs instead of into the stomach. And when that happens over and over, the lungs will get irritated and infected. And that infection is the pneumonia. So the real question here is not why did he get pneumonia? The real question is why was material getting into his lungs in the first place? And why did nobody stop it? Now look, we've all aspirated at one time or another. You take a drink wrong, the water goes down the wrong way, maybe you eat a pretzel and it goes down the wrong way. Those things happen. And when they do, typically you're fine. But it doesn't happen repeatedly. Aspiration pneumonia generally happens to people with a swallowing problem. The medical word for swallowing problem is called dysphagia, and it is extraordinarily common in nursing homes. Now, dysphagia often happens after a stroke. It can happen with dementia. It happens with Parkinson's disease a lot. And it happens when somebody is maybe heavily sedated. Essentially, the muscles and the reflexes that are supposed to help keep food out of the airway just stop working correctly. And food and liquid starts to slip into the lungs, sometimes without the person even coughing. Now that last part is called silent aspiration. And it is as dangerous as it sounds because no one sees it happen. The resident doesn't cough, doesn't choke, doesn't give any visible sign. And food or liquid could be going into their lungs at every single meal. When a resident has a swallowing problem, the facility is supposed to know that and they're supposed to manage it. Now that typically starts with a swallowing evaluation, usually from a speech therapist. And it means modifying the diet that the resident gets to a texture the resident can actually handle safely. That might be thickened liquids, pureed food, or a softer diet. It means positioning the resident fully upright to eat, not slumped halfway in a bed or laying down in bed, as I've seen happen before. It means supervised meal times where an employee is actually present and paying attention to the resident, not looking at their phone. It means not just dropping a tray off at the resident's bedside and leaving them. Supervision, monitoring, positioning, proper diet. This is not above and beyond. This is basic standard care, and it works. When these things are followed, the risk of aspiration pneumonia drops dramatically. And when they're not followed, when a high-risk resident is given regular thin liquids and left alone to eat in whatever position they landed in, the risk of aspiration compounds meal after meal, day after day. Now, here's what I want you to watch for when you visit your mom or dad, because you can catch this yourself. Watch your loved one eat and drink. Do they cough or choke during the meal or right after the meal? Does their voice sound wet or gurgly after they swallow, like there's liquid sitting in their throat? Do they pocket food in their cheeks? Do they seem to get congested every time after they eat? Those could be signs of aspiration. And the biggest warning sign of all, do they keep getting pneumonia again and again? Now look, one bout of pneumonia, that can be bad luck. That just kind of happens. But pneumonia that keeps coming back, that's not bad luck. It's often a sign that someone, or something I should say, is going into the lungs at every meal and nobody has paid attention to it and nobody has fixed it. It usually isn't one dramatic event. It's repetition. The same thing over and over. Dad went to the hospital with pneumonia in January, and then he went back in March, and then he had pneumonia again in May. Each time, it was a fresh illness, a run of bad luck, as the nursing home might say. But it's not bad luck. It was the same unmanaged swallowing problem, putting food and liquid into his lungs again and again. And that recurring pattern, pneumonia, hospital, recover, pneumonia, hospital, recover, that is a warning sign that something isn't right at the nursing home. And where there's repeated pneumonia, there's often a sign that there is a systemic failure in providing that resident with the proper care. And you need to know that. Now, here's the one record that I asked for in every single one of these cases. I asked for the swallowing evaluation and the diet order, and I also want to know what kind of food and liquids the resident is given. Was your loved one ever assessed for a swallowing problem? What texture of food and liquid were they supposed to be getting? That should be clearly identified in the resident's chart. And when I compare that to what they were actually served, you might find a problem. Because in many of these cases, the chart will say thickened liquids, and the family watched an aide hand dad a regular cup of coffee and a sandwich. That's the negligence. They had a duty to provide thickened liquids and to monitor him eating soft food, and yet they provided him with regular liquids and a sandwich that he couldn't eat, and then they walked away. That is a recipe for aspiration pneumonia and possibly a recipe for death. Now let's talk about hospital records, because hospital records may also give you some insight onto the care or lack of care provided by the nursing home if you know what to look for. Now, when a resident is admitted to a hospital with aspiration pneumonia, the hospital records may often just say it right out there in the records. This resident has aspiration pneumonia. Or they'll describe an infiltrate in the specific part of the lung, often which is in the lower right lobe, which is exactly where some of this aspirated material tends to land. The records may note that the patient arrived with a known history of dysphagia. That's important. So you may have a situation where the hospital knew that he had a swallowing problem and they documented it, while the nursing home that fed him 3 meals a day, every single day, acted like they had no idea. Line those two records up next to each other, and the poor care becomes even more clear. Now, let me kind of distinguish between what real care looks like versus what happens when people get hurt. Real care at the nursing home looks like this. A resident is sitting fully upright. An employee is by their side. Food at the correct modified texture, small bites, gives them time to fully chew and swallow, and the person is kept upright for a period of time after the meal so nothing comes back up and then goes down wrong. Now, when I get these types of cases in my office, the care often doesn't look like what I just described. What I see in these cases often looks like the tray is just kind of set down in front of the resident who might be slumped in bed, regular food, thin liquids that they're never supposed to have, and an aide is already 3 rooms away because there's just not enough staff on the floor. That is how aspiration happens, meal after meal, until it becomes the pneumonia that finally ends the resident's life. And so much of this is caused just because there's not enough staff, or the staff that is there just didn't pay attention. So what should you do if you see this trend with your family member? First, if your loved one is still living and you're seeing repeated pneumonia, a wet or gurgly voice, or coughing at meals, demand a swallowing evaluation by a speech therapist. It is the nursing home's job to catch this and to manage it. And then follow up. Make sure that the nursing home does exactly what they're supposed to do. Second, if you've already lost someone to repeated aspiration pneumonia, get the records, get the swallowing evaluation, get the diet orders, get the dietary records, get the nursing notes. See whether what was ordered actually matches what was served. And third, if those records don't match, or if there was never an evaluation at all, despite obvious signs that there should have been, talk to a lawyer who handles nursing home cases in your state. This is very often a real case that can result in a legal case being filed with the court. Of course, I'm happy to talk with you. You can reach me at 314-878-9797. If I can help you in Missouri and Illinois, I'd be happy to do so. Otherwise, I can try to connect you with somebody in a different state. I want to tell you something that's kind of sad. Many nursing homes will downplay their role in aspiration pneumonia. They downplay their role in just about everything. But specifically in aspiration pneumonia, they'll say, hey, it's just one of those things, or they'll just blame it on the aging process. But with aspiration pneumonia, the real question is how it kept getting into his lungs, meal after meal, and whether the people who were supposed to be protecting him were paying any attention to him at all. You are allowed to ask that question, and you should. In my next video, I'm going to show you another injury that nursing homes love to brush off, or blame on old age, or just cover up. And that is a fall that results in bleeding on the brain. So go watch the next video, and I'll see you over there.